Meeting to order. Welcome to meeting number 2 of the House of Commons Standing Committee on Human Resources, Skills and Social Development and the Status of Persons with Disabilities. Today's meeting is taking place in a hybrid format pursuant to the House Order of November 25, 2021. Members are attending in person in the room and remotely using the Zoom application. The proceedings will be made available via the House of Commons website. So you are aware the webcast will always show the person speaking rather than the entirety of the room. I would like to take this opportunity to remind all participants to this meeting that screenshots or taking photos of your screen is not permitted. The proceedings will be made available via the House of Commons website. To ensure an orderly meeting, I would like to outline a few rules to follow. Members and witnesses may speak in the official language of their choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen of either floor, English, or French. If interpretation is lost, please inform me immediately and we will ensure interpretation is properly restored before resuming the proceedings. The raise hand feature at the bottom of the screen can be used at any time if you wish to speak to the chair or alert the chair, or simply raise your hand in the room. For members participating in person, proceed as you usually would. When the whole committee is meeting in person in a committee room, keep in mind that the Board of Internal Economy's guidelines for mask use and health protocols. Before speaking, please wait until I recognize you by name. If you are on the video conference, please click on the microphone icon to unmute yourself. Those in the room, your microphone will be controlled as normal by the proceedings and verification officer. When speaking, please speak slowly and clearly. When you are not speaking, your mic should be on mute. A reminder that all comments by members and witnesses should be addressed through the chair. With regard to a speaking list, the committee clerk and I will do the best we can to maintain consolidated order of speaking for all members, whether they are participating virtually or in person. The study, as you're aware, we're studying Bill C-3, an act to amend the Criminal Code and the Canada Labour Code. Pursuant to the order of reference of Thursday, December 9, 2021, the committee will commence its consideration of Bill C-3, an act to amend the Criminal Code and the Canada Labour Code. And we will wait until we have the minister who is doing sound check. I will suspend momentarily while we await the arrival of the minister virtually.
Chair.
Call the meeting back to order. We had momentarily suspended, so the meeting is now, the committee is now in session. I would like to welcome our witnesses, beginning with the Minister of Labour, the Honourable Seamus O'Regan, as well as Department of Employment and Social Development staff and Department of Justice. And we'll go through those as they appear. Minister, we begin with 5 minutes of opening remarks by yourself, then followed by a question and answer session. This was scheduled from 11 o'clock to 12 o'clock, Minister, so the committee will decide how it wants to proceed when we get to 12 o'clock. Thank you.
Thank you, Mr. Chair. Thank you to the members of the committee. I want to acknowledge that I am joining you from the island of Newfoundland, which is the traditional territory of the Beothuk and Mi'kmaq peoples. And I want to thank you for inviting me to discuss this bill and for your patience through all the technical difficulties that we've had. It is a sad reality that across Canada, some workers do not have access to paid sick leave. In fact, 58% of workers in Canada do not have any paid sick leave at all, 58%. So it means that many workers cannot afford to stay home due to an illness. So this is a significant issue. For some people, missing paid days due to illness means not being able to make your mortgage, your rent, or deal with the many other bills that you need to pay to support your family. It is simply an unfair choice to impose on Canadian workers. And despite the progress that the Government of Canada has made on the labour front, it is clear that the pandemic has exposed the gaps in our social safety systems. So the time has come to close the gap. The time has come to close the gap on paid sick leave. Currently, the Canada Labour Code provides employees in federally regulated industries with several unpaid leaves related to personal illness or injury, as well as 3 days of paid personal leave that could be used to treat an illness or injury. But however, if we look at the statistics from 2019, we find out that Canadian workers took an average of 8.5 days of leave for illness and issues related to a disability. So it's become very clear 3 days is not enough. This legislation would amend the Canada Labour Code to provide 10 days of paid sick leave per year to workers in the federally regulated private sector. This is a change, I think, that will make a real difference in the lives of working Canadians. As of today, there are approximately 18,500 employers in federal regulated industries, but together this represents over 950,000 workers. Le secteur sous réglementation fédérale est formé de...
The federally regulated sector is comprised of workplaces from a broad range of industry. It includes interprovincial air, rail, road, and marine transportation, pipelines, banks, postal and courier services, among other things. These are all industries people count on every day.
...the federal government to support these workers. The bill before us today not only allows workers in these vital industries to stay home to rest when they are sick, but it also prevents the spread of illness in the workplace. Specifically, it would amend Part 3 of the Canada Labour Code. The premier changement vise à faire...
The first change is to provide that for each calendar year, employees would accumulate 1 day of paid leave per completed month of employment, up to a maximum entitlement of 10 days per calendar year.
We do paid leave provisions related to illness or injury under the Canada Labour Code. These two changes impact 6,000 employees, actually 582,700 to be exact, in the federally regulated private sector who don't currently have access to at least 10 days of paid sick leave. Mr. Chair, increased paid sick leave would support employees by protecting them in 3 ways. Tout d'abord, les congés.
First, paid sick leave would protect workers' incomes. Workers won't have to choose between staying home to get well and getting paid. Second, it would protect their jobs. And finally, it would protect workers' health. Additional sick days would allow them to recover at home, which would protect others in the workplace.
In addition, the government would like to see paid sick leave implemented across the country in all sectors, Mr. Chair. To do that, we will discuss a plan to legislate sick leave across the country with provinces and territories, respecting their jurisdiction and keeping the unique needs of small business owners top of mind. Currently, not every province and territory has paid sick leave provisions, and that shouldn't be the case, Mr. Chair. We have a responsibility to make sure all Canadians have access to paid sick leave. This is essential to Canada's economic recovery. It will protect workers' health now and into the future. It's time to close the gap that the pandemic exposed in our social safety net. Mr. Chair, members, as we finish the fight against COVID-19, a vital step towards Canada's economic recovery is to make sure that Canadians have access to paid sick leave. And I want to quote from economist Jim Stanford in the Globe and Mail, who said, "It would be reckless and short-sighted to return to a pre-COVID normal that compelled sick workers to show up regardless of the risk to others." With this bill, the government's taking action to give workers the support that they need to keep themselves healthy, to keep their workplaces safe. Hardworking Canadians across the country are counting on us to make these necessary and important changes. Thank you for your time.
Thank you, Mr. Minister. We'll now move immediately to first rounds of questions, and we'll go to Madame Kusi for 6 minutes, please.
Thank you, Chair, and thank you, Minister. It's always a pleasure to see you, and I recognize the importance of this bill and the urgency in which we must pass it, given your appearance yesterday, your appearance today. So I want to cut to the chase then to the two issues which came out of the Senate, which are being reported in the media today. And the first one being Section 1.2, with the bill currently reading that an employee earning at the beginning of each month after completing 1 month of continuous employment with an employer, 1 day of medical leave of absence with pay up to a maximum of 10 days in a calendar year. So what we're hearing is that you, the government, might seek to have 10 days begin automatically at the start of employment rather than accrued over time, with the rationale being in many cases that someone might need the 10 days before the 10 months of being employed. However, providing all 10 days of medical leave pay up front could impose costs on employers in high turnover industries, such as road transportation, where employees change employers frequently, and by accumulating paid leave throughout the year, new and departing employees would receive days of medical leave with pay for the months that they are with a particular employer, and thus limiting costs on employers in high turnover industries, for example. So I want to ask you very upfront, where is the government at in your thinking with this request to go to the immediate bulk entitlement as opposed to the accrual method? Where are you at, Minister?
First of all, thank you very much for not only your comments today, but during several mic checks, I couldn't help but listen in. And Madam Kusi, I appreciate some of the words that you said, particularly my role as Natural Resources Minister. I think many members recognize I took responsibilities there to heart. And one of the things I will take with me is the importance of workers, not only to our natural resources sector and to the future of our natural resources sector, but here. So I'll cut to the chase. We are open to amendments, yes. We are open to, I think, good constructive conversations, and certainly I would look at anything in writing that was brought forward. There were some issues, for instance, on, the accumulation of sick days. As we'd said, they would accumulate as presented to you, 1 per month. Perhaps it could be offered that we offer a certain number of days as a minimum up front. I think we are willing to look at anything, Madam Kusi, that would encourage people, or at least not cause people to hesitate to stay home if they feel they may have symptoms. I can tell you that the present imperative put upon us by Omicron is real. I think that even since I spoke to the Senate yesterday, I think that, we are dealing now, and we have a better, although not a complete understanding of this variant. The importance of us acting upon this is so immediate.
Thank you, Minister. I'll stop you there, please.
This could not be more time.
So I could get to my second question. Thank you, Minister.
Comments.
Indeed, and Omicron is real, but so is the necessity to get our economy going and to get inflation under control. So I'm going to turn to the second concern that came out of the Senate yesterday, hoping that you will be able to address it, very frankly, more directly, more completely, and more specifically. But the other portion of the bill, which is where I understand we could see some movement, is Section 1.6. that the employee may, in writing, no later than 15 days after the return to work of an employee who has taken 10 days of medical leave of absence with pay, require the employee to provide a certificate issued by a healthcare practitioner certifying that the employee was incapable of working for the period of their medical leave of absence with pay. So what we're hearing is that you, the government, again, might get rid of this portion entirely. And one trend we have certainly heard from many stakeholders we've talked to is that they strongly support leaving this portion in the bill and would, in fact, have a lot of concerns without a medical certificate that employers would have no recourse if an employee might be using days when they're not sick. So should you move on this portion of the bill, before you move, I should say, I think we need to have a very serious discussion about this because, in fact, the support of the official opposition might rest on your decision with this. So I'm going to ask you again, please, in regards to Section 1.6, where is the government at in terms of requiring a sick note either upon illness or upon return to work? Thank you, Minister.
Thank you. First of all, as you stated, as currently drafted, the employer may require no later than 15 days after the employee's return to work that the employee provide a certificate issued by a healthcare practitioner certifying that the employee was incapable of working for the period of their absence. Listen, both of these things presented are kind of either or. Either we do it all or we don't do it all. Or there is room for a compromise that would acknowledge arguments on both sides, how this country was built. I would say, look, I can understand how this can be onerous for workers, particularly in the light of the pandemic. And there's data that indicates that workers are less likely to use the sick leave that they're entitled to when a doctor's note is required. There was an Ipsos poll done, that indicated 82% of Canadians would rather go to work sick than obtain a medical certificate. So that's not in keeping with the spirit of this legislation. As I've said, I am mindful of potential barriers to access for paid sick leave and potential ways to address them. I'm also, very much aware of businesses' concerns about abuse.
Thank you, Minister.
Again,
also very inconclusive, but thank you.
Your 6 minutes have concluded. Now to Mr. Long for 6 minutes.
Thank you, Mr. Chair, and good morning, Minister. It's great for you to be here with us today, and good morning to all of my colleagues around the table. Just a few words at the start here about what we've all been through, all of us from all parties over the last couple of years. I mean, obviously, we're in unprecedented times. We know, like the Minister just said, that Omicron is upon us, and it's a game changer for what we're dealing with in the future. I'm very, very proud of my government. I'm very, very proud of all MPs across all party lines, how we have collaborated together over the last 2 years. We've delivered programs. I'm proud of what we've done. I mean, no one knew in March of 2020 what we'd be faced with. And, whether it was a CERB or CEBA or wage sub or rent support or business loans or what have you, we were there as a government for Canadians. We were there to support Canadians. And certainly one thing that was missing, it's bothered me really for over a year now, was, I would get people coming into my constituency office and they were sick and they had to make a decision between going to work sick or staying home and not being able to feed their family, pay their mortgages or what have you. So the fact that we're coming forth with C3, the fact that it's going to give people who are sick the opportunity to be home, to get better, to not spread COVID, what have you, around the workplace is profoundly, profoundly important. So, Minister, again, thank you, and I apologize for yesterday. I know there was some delays. I know your time is precious. My first question to you, Minister, is, from your side and the department side, can you just describe the necessity of paid sick leave and how you've come to where we are right now?
Thank the honourable member from St. John Rothsay for the opportunity. Let me say this is not a matter of my valuable time, etc. There is no more important place for me to be than right here with you right now, as it was yesterday. Omicron's in Canada, and it is spreading. And there have been many times, I'm sure, that you've heard before this committee and through other committees about the urgency of what is before you and the need to act fast. I cannot tell you how urgent this legislation is, and the signal it would send to so many workers before Christmas that we have their backs, that it is okay to stay home, and they should not have to make difficult decisions on their rent or their mortgage. We need them to stay home, for them to stay well, for their families to stay well, for all of us to stay well. The urgency of Omicron is real, and this will send a signal and a tangible way for us to minimize the impact of this variant. The second thing I would say, and this is in response to a comment from Madam Kuzi, and let me just say that we are very well attuned to the costs borne by businesses. And it is very easy for politicians to appear before committees like this and say, but, it is much worse if we don't do this. It is much worse if we don't do this. It is much worse to small businesses, big businesses, to all businesses, to us, if we don't take measures like this. It is real. We know that. We've been through it. We don't want to go through it again. We don't want to go through a complete lockdown of this economy again. There are things that we can do that we absolutely and essentially need to do. And all I want to do is assure honorable members, and I've sat on a committee similar to yours, that I am not abusing this language or these sentiments in front of you. This is not political rhetoric. This is real. The cost of the economy, if we do not take measures like this, is enormous. We know that because we're coming out of it. And the urgency of acting on this has never been more vital. Omicron is here.
Minister, and thank you for that. Just for the record, can you state again the percent of workers that are not covered by sick leave in Canada?
58%.
58%.
58% of workers. Now, you're talking an awful lot of people in retail and other industries. I mean, we are talking right now about the 6% that are governed federally, under federal jurisdiction. These are some large companies and small companies, 15,000 in total, of all shapes and sizes, but many of whom have already shown very real leadership in this space. But just to remind honorable members too, the reason why 10 days is so essential is that that is for the most part 2 working weeks. And how long do we ask people to quarantine for? 2 weeks. That's why the 10 days are so important. It will cover people who we asked to quarantine for 2 weeks.
Thanks for that, Minister. Minister, what would you say to anyone who says that this bill is being pushed through too quickly?
We've heard it so many times before, and I'm sure there are ministers of all parties who have perhaps abused that authority. I am telling you, I am not pulling that plug or pulling that chute, whatever you want to call it. I am not doing it easily, nor am I abusing my authority, political or otherwise. It is imperative that we act quickly. It is absolutely vital that we act quickly. And I implore members of the committee to take me to heart on that.
Thanks for that. Minister,
30 seconds.
Just a final comment. I'm very, very happy to hear that you will be entertaining some amendments. I know some of the other parties do have some suggestions, so I'm really happy to hear that too. And Minister, I thank you very much for your time, and we'll see you soon.
Thank you, Mr. Long. We'll now go to Madame Chabot for 6 minutes.
Bonjour, merci, Monsieur le Président.
Good morning. Thank you, Minister. In what you said today, you reiterated something you had said in the House when the bill was introduced, that its purpose was to strengthen the social safety net. And we believe that is important. Giving 10 days of paid sick leave to all workers who are not entitled to them at the moment is a plus. I believe that is a social benefit, an important one. one that employers should consider because it contributes both to attracting and keeping workers. But with regard to the social safety net, we're really not yet there. When I think about people who have serious diseases and have only 15 weeks of employment insurance. In fact, the whole employment insurance system covers only about 40% of workers, so there is a long way to go, Minister. My question on the 10 paid days of sick leave is this. It seems important to me that this be drafted as a right. I do have some questions. To ensure after 1 month's service that employers will immediately be able to have those 10 days and won't have to accumulate them month by month. To clarify what you mean by continuous service. Does it mean that over a given month, if a worker needs to be away on a different kind of leave, that will not be counted as part of continuous service? I also think there should be a clarification on whether people can take a half-day's leave. You say that the employer can require them to take a full day. So are you open to elucidating those provisions which would prevent accumulation, really? Thank you for the question. The pandemic has shown that many workers don't have access to paid sick leave.
No one should have to choose between staying home when they're sick or being able to afford rent and groceries. Nous proposons des modifications au Code canadien.
We are proposing amendments to the Canadian Labour Code to offer all federally regulated employees 10 days of paid sick leave.
Important that what we are asking for basically is a floor. There has to be a minimum 10 days offered. So in instances where, to get back to perhaps a common misconception, these aren't stackable days. These are top of days that you may already have through your employer or through your collective agreement. What we are looking for is a minimum of 10 days so that everybody has those 10 days, whether they are presented through this legislation or whether they are presented through other collective agreements or agreements with the employer. I will ask my deputy perhaps to answer some of your questions more specifically. She's standing by. Deputy.
Thank you, Minister. Merci, Madame Chabot, pour vos questions.
Thank you, Minister, and thank you for your questions, Ms. Chabot. You referred to some provisions that are in Bill C-3. Accumulation of 1 day per month. You talked about continuous service. And under the bill, employers could require that an employee who wishes to take a half-day's leave would have to take a full day's leave. These are the current provisions in Bill C-3. The minister indicated yesterday that amendments could be considered. He said he would be open to that, and as he said yesterday, he might consider amendments, but would be very interested in... Yes, thank you. I'll come back. I have another question, Minister. You didn't talk about criminal law. You were engaged in consulting workers' organizations to make sure that criminal code amendments did not interfere in any way with the right to protest or engage in other forms of labor disputes. How can you make sure that won't be a problem?
Well, I'm sure, or Mr. Brown, but we were involved with justice officials to assure our stakeholders that that was not the case. Obviously, ensuring that the right of assembly, the right for peaceful assembly, and the ability of people to strike was not an issue, and we've been assured of that. In fact, I can ask her to maybe say a word. Lori Wright is here from Justice. Maybe she can give you the technical assurances, Madame, that you're looking for.
The answer.
Thank you very much for the opportunity to speak to the provision. So the bill importantly contains in it a defense that means that a person who was engaging in purely would not be found to have committed the offense, and it's well established because this is a defense that appears in another part of the criminal code as well, that communication is defined quite broadly. It would certainly include those who are picketing in order to be exercising their right to strike, and as well would cover a variety of types of communicative behavior.
Thank you. We'll now move to Mr. Bulleris. Mr. Bulleris, who is on behalf of Madame Zerillo. Monsieur.
Merci. Merci beaucoup, Monsieur.
Thank you, Mr. Chairman. It's a pleasure for me to be able to speak to you, Minister, on this important bill. I found it interesting to hear you talk about how urgent you believe it is to pass this bill so that we can provide paid sick leave to federally regulated employees. At the outset, I would have liked you to feel it was as urgent 12, 18, and even 24 months ago when the pandemic was at its height. It would have protected people and perhaps prevented a lot of disease transmission and some of the burden on our healthcare system. This is something that our leader asked for 22 times in the last session. Well, here it is. But it did take time. A question, well, following on a question by Ms. Kuzi, you've opened the door to workers having a few days of sick leave available up front, because what the bill provides for is a day per month, but they start off with nothing. So for them to have several days available, let's say 2-3 days, they would have to work for 2 or 3 months or even more if they were hired in mid-month. Healthcare specialists are telling us that it's very rare for people to take 1 day when they're sick. Usually they need 2, 3, or 4. Would you be open for them to have available, if not all 10 days, at the beginning of their employment, at least several?
We would.
Yes, we would.
To see it in text, but yes, we would be open to that. We've heard some very good arguments to be made, and again, I don't think that this is a one thing or the entire thing. I think that we can reach an honorable compromise, I think, on this, but certainly we do not want to hinder people's ability to do this. And the only other thing I would add, Monsieur Blouis, is that to use a religious metaphor or simile, it's kind of there's nothing more irritating to long-standing parishioners than the newly converted. Here we are, as you said. This is important, and I would say that the urgency of it has changed even in the past few days.
Yeah.
So while I acknowledge that 20 months ago, 22 years ago, yes, this would have been a good thing, I would also say that even what we know now about Omicron and where it is in this country, the urgency of this has changed demonstrably in the past few days.
Merci, Monsieur le Ministre. J'ai une autre question.
Thank you, Minister. I have another question. In the way the bill is written, it would seem that everyone is a new employee. I understand that it might take longer for a new employee to accumulate 10 days, and a bank of 2 or 3 days at the outset might be useful. This is also how collective agreements work, so we might find a compromise on the principle. But what do we do with somebody who's been who has 5 or 10 years of seniority in a company? If everybody starts off at 0, does the employee who has seniority start off with 0 as well?
The notion here, yeah, I mean, the notion here is that it'd be accumulated for new employees, that they would accumulate those days over time. And, you know, arguments have also been made to us that perhaps instead of at the beginning of a calendar month, that in fact the 1 day is accrued after 30 days, or, you know, roughly 4 weeks perhaps of service, of employment, and that would not really cost much more, if any more money, but it would allow greater flexibility for those employees who may be starting mid-month. They wouldn't have to wait a whole month and a half. They would just, you know, they would get it after their first 4 weeks of working. That's something that we're looking at. On the issue of seniority, I'm just going to ask my deputy to clarify that, just to make sure that you get a clear answer. Deputy?
Oui. Merci, Monsieur Boulris, pour la question.
Yes, thank you for the question, Mr. Boulris. As it is currently drafted, the bill does treat all employees the same without consideration for seniority. In the current form, as the bill stands, a day would accrue to the employee at the end of the month, regardless of whether that employee was a new employee or had been with the organization for some time. Thank you. So that's clear. We could work on it, I think. Moreover, on the possibility of a doctor's note 2 weeks after somebody has taken a sick day. If somebody has taken a single sick day, I think that is a lot. Asking for a doctor note every time you take a day off, for example, going to the doctor 2 weeks later and saying, I took a day off 2 weeks ago because I was sick. That's a lot of paperwork. Could we not envisage saying, for example, if somebody has taken at least 4 or 5 days off, that is when the need for a doctor's note would kick in, and that would not act as an impediment?
Yes, I would be open to that. I think that what we're looking for is you know, to Ms. Kuzi's concern for, you know, we're talking about employers, I think they just want to make sure that there's some assurance or a tripwire to make sure that, you know, you don't see an abuse. But we have a saying in Newfoundland, you know, about the biggest sleevine in the harbor. And that just means that, you know, the people who sometimes abuse rules and that sort of thing shouldn't dictate the behavior and the privileges that should be afforded to the great majority of people who abide by these things and do so honorably. So it's just trying to find, you know, an honorable compromise here. I think we would be, you know, open to that. You know, we have also heard from stakeholders in the medical community, as I believe you have too, and I have, you know, said that as we deal with the pandemic, as well as a stretched healthcare system as it is, to line people up so that they are making appointments to go get doctor's notes is also cumbersome, and that's something also, you know, I think that we have to reflect on. So let me just say that we are open to it.
Thank you, Minister. Now I will need direction from the committee and the Minister, because this meeting was scheduled from 11 to 12 to hear from the Minister before we go into the second round. What is
my intention, Mr. Chair, was to spend an hour with you, and I believe we've accommodated for that. So I'm in your hands.
So you can, from the time you appeared, the hour began then. What is the wishes of the committee? Do you want to keep the Minister for the hour,
yes,
which will reduce the time from the officials? Am I getting, okay, that's direction from the committee. Then thank you, Minister and committee. We'll move to the second round with the first questioner from Mr. Généreux for 5 minutes.
Thank you, Mr. Chair, and congratulations to you on your being elected chair of our committee. We're in good hands so far. I'll posit so far. Yeah, it's a qualifier. And Minister, thank you for accommodating the time. It's certainly a pleasure to finally get you here to be able to talk about this obviously very urgent legislation. I think the piece that I want to talk to you most about, Minister, in my brief 5 minutes, is about the ability to look at some of the amendments that you've been open to so far. It sounds like they're piling up a bit. So I also want to make sure that one doesn't get lost in that, and that's the private member's motion of my colleague, Mr. Tom Kimmich, on the bereavement leave, and including it's one thing to talk about sick leave, but we've seen so many Canadians have to then struggle post-death with their loved ones. And for your quick refresher, Minister, that's supporting parents who have received the trauma of a miscarriage by allowing them to receive 3 days of paid bereavement leave. And we're committed to providing up to 8 weeks of paid leave from employment in the event of a child's death or stillbirth. So we will be submitting that in written form as an amendment, but hoping that we get your support from that. Do want to then just come back to what I think on this side of the table, we're very concerned about getting this done urgently. And I think from the very basic starting point of my wife, she's a surgeon. She has been on the front lines. She has looked in the people's eyes as they have gone through probably one of the most traumatic experiences of their lives. She's had to unfortunately be there when people have passed away, and the urgency of doing this, I can say from my point of view, is very important. But to that piece, to getting this passed quickly, I'm really worried about your timeline here. So can you please talk about the bereavement leave, but also just tell us how in the world you're going to get this done in, I guess, what's sleeping 48 hours the Parliament is essentially sitting for?
Great question.
Thank you. I thank the honourable member for the question. And first of all, I think what Mr. Kimmich has gone through on a personal level is it's gut wrenching, and I can't imagine. But I will commend you and the members of your caucus for the amount of solidarity that you've shown him. I've certainly heard from many members of from your caucus who have approached me talking about this, I think on a deeply personal level. And let me just say outright, I am fully prepared to take up the issue and give it all the consideration it deserves. So I am very much open to seeing what we can do here. As you pointed out, there are time constraints. We are keenly aware of that. I think this is an excellent opportunity, and it makes a whole lot of sense. So let's see if we are able to accommodate it here. And just for the edification of members, a federally regulated employee is currently entitled to up to 10 days of bereavement leave in the event of a death of an immediate family member. In the event an employee is on compassionate care leave or leave related to critical illness, and the family member for which they are caring for dies, then they are entitled to take bereavement leave. So that's where things stand right now.
And I think, Minister,
we are certainly open.
Thank you. And I think our committee is intimately aware, because there was if I may say, a terrific private member's bill that came to this committee that was sponsored by myself in particular, that helped to increase the bereavement leave. So I know this committee is intimately aware of that. But what you just hit on, the federal regulated employees, it's and I believe the number you said was 582,000 employees. That is in the airlines, the banks. We all know that here. That's not everybody. So in terms of, you even have more work ahead of you in terms of getting the provinces on side with this. So to say that, you know, we urgently pass it here, there's so much more to be done. So I'm I guess again I'm a little worried about your timeline here, Minister, in terms of actually this making an immediate on the ground impact for Canadians, like you indicated in your opening comments.
If we can give the opportunity to some 500,000 plus workers in this country, the assurance that staying home is the right thing to do and that they will not be penalized financially for doing it, every bit helps. It's a good start. You were right to point out that we've got a lot of work ahead to do. 94% of workers are within provincial and territorial jurisdiction. So, you know, and we have to be very respectful of provincial and territorial jurisdiction here. So we got a lot of work to do ahead of us. I plan on convening a meeting very early in the new year with my provincial and territorial colleagues to discuss exactly this. To make this national? What can we do collectively to make this a national plan? That is certainly our intention. So I agree. This is the beginning. It is a heck of a good place to start. And the more people that we can give the assurance to stay home and do the right thing with Omicron now in Canada, the better. The better.
Now, Mr. Van Bynen for 5 minutes.
Thank you, Mr. Chair. Minister, thank you for taking the time again to join in the committee and to answer our questions. Bill C-3 is so important to strengthening Canada's safety net and ensuring that Canadians don't have to worry about staying home if they're sick or being unable to pay their bills. I also want to take this opportunity to quickly say thank you to the healthcare workers in my riding and across Canada who've been working day in and day out in an already overwhelming environment to keep us safe and to protect our health. But since 2019, the government has created greater access to paid sick leave for Canadians. So could you walk us through a brief timeline of the work that the government has done since then?
My thanks to the honourable member, and thank you for acknowledging the healthcare workers in his riding and healthcare. I would add, you know, obviously to healthcare workers right across the country. I'm just thinking of what one representative of workers, frontline workers, told me on my third day on the job. She said, "Stop calling us heroes. Start treating us like human beings." And that has certainly stayed with me, as I'm sure if you've heard a similar message, I'm sure it's stayed with all of you. We have to put the things in place, the tangible things in place to protect people. You know, and that gets also obviously to the second part of this bill in dealing with the intimidation that many of our healthcare workers saw over the course of last summer. I think to the utter disgust of millions and millions of Canadians. The clarification to law enforcement officers so that they know exactly what they need to do, that the penalties would be increased, and importantly, that healthcare workers in a very real way know that the people of this country have their backs, that we support them, that we will not tolerate that sort of behavior from people in our healthcare system that we are asking so much of, particularly during this pandemic. I may be betraying some of my own sympathies as the son of a nurse, proud son of a nurse, and that's how I was raised. But I think that anybody who has benefited from the care and pride and dignity of our healthcare workers understands they need that protection, and they should not be subject to that sort of abuse.
Thank you. I've had the opportunity to contact Arden Crystal, the president and the CEO of South Lake Regional Health Center, in my riding and asked her for her thoughts on Bill C-3. Ms. Crystal is by and large supportive of the legislation, particularly the changes to the criminal code related to intimidation and impeding access to services. This commitment that we've made to Canadians, and I'm happy to see that we're collaborating on making it a reality. Is it possible that there may be some confusion as to what the bill targets? Could you tell this committee what it doesn't target?
I thank the honourable member for the question. Maybe I will ask my my deputy to give clarification.
I will turn to Lori Wright, the Justice Representative education representative to answer the portion.
Clear chain of command here.
Yeah.
I'm happy to take my spot in wherever that chain of command puts me. Thank you so much for the question. So I think what's very important to understand about the part of the bill that would create the new criminal offenses around intimidation of healthcare workers and those seeking health services, and also the obstruction of those who are trying to access healthcare facilities, is that the focus of these amendments is on threatening and intimidating behavior. So we know that the obstruction offense does not apply to persons who are merely at a place to communicate information. And so peaceful protest that is lawful and has only a minor impact on access is not going to be caught. And as I had been able to state in response to an earlier question, that means that also people are able to exercise their labor rights, including their right to picket, so long as they're doing so peacefully. They're not going to be caught by the offenses. So just to sum up, the purpose is to try to capture threatening conduct where there is violence or threats of violence, and not at all to touch on people's peaceful assembly and freedom of expression rights.
That's Mr. Bynum. We'll now move to Madame Chabot for 2.5 minutes.
Thank you very much, Mr. Chair. After this last answer, I would like to go back to this issue: protect health workers, all professionals, those who accompany them, and protect as well patients. We are all for that, obviously. We have seen some protests in front of vaccination clinics. I understand that we target this. But as I said earlier, it's important to have a guarantee, because health workers want to be protected, but they also want their rights to be respected. That also means being protected. They want to have better conditions. So sometimes there will be protests, there will be strikes and picketing in front of health institutions. So why strengthening this penalty? And how can we make sure that this right will be preserved? It's very important that we have this assurance in the bill.
I will speak to it in broad strokes, Madame, and then I will ask Ms. Wright perhaps to get more specific. But let me just say that it is clear in the bill that this is about obstruction and intimidation of healthcare workers. They should not be in a circumstance in which they are either obstructed from performing their duties, and that includes entering the workplace, nor should they be intimidated in doing so. So we were clear on that, and there is obviously, as the Minister of Labor, but also for my officials in the labor program, there is a keen sense that we in no way want that to happen, that there is any sort of infringement upon their ability to strike, to demonstrate in a peaceful way. But we want to be clear that the intimidation and obstruction of healthcare workers is not something that we will tolerate. Ms. Wright, I will allow you to speak on this in a more clear way for the honourable member.
Mr. Minister, if they could add that to a following question, or maybe Minister's round, we're over. We'll now go to Mr. Boulouris for 2.5 minutes, Monsieur.
Merci.
Thank you, Chair. I'll try to do this quickly. I have two quick questions. Regardless of the mechanism through which people accrue their 10 days, can we be clear on the fact that if, for example, an employee only uses 4 sick days at the end of the year, come next January, they don't start at 0, the 6 sick days they had not used are pushed back to next year until they hit the cap of 10 days.
I'm just going to look for a nod from my deputy here, but it is, yes, Sam from Andrew. Thank you. So it is, yeah, no, it's carried over, Monsieur Blouis. So they don't start from 0. The intention is to make sure that employees always have 10 days, but that for new employees that it is accumulated over time, that this is something that they get, one for, every month as it's written right now, every calendar month. Although, as I said earlier, we would be open to being flexible on that if it meant 30 days or, 30-day work period.
Another question. If an employee, as per their collective agreement, already had, for example, 3 paid sick days as per their work contract, would the 10 days in the law mean that they have 13 days, 10 as per the Act plus the 3 in the collective agreement, or can they only accrue 7 more new days?
I will look for a nod from my deputy here, but I am fairly confident that what we were talking about here is the 10 minimum days. So if they have 3, then we'll make sure that they have an additional 7 in order to make that 10.
Monsieur le Président.
Thank you, Chair.
Mr. Builders gave us an extra minute. We'll, from what I'm looking at with the timeline, we'd have time for a 5-minute round from the Conservative Party and 5-minute from the government. So, Minister, are you able to accommodate that?
Yes.
10 more minutes. So with that, then we'll go to 5 minutes to Mr. Benson.
Thank you, Chair. And it's nice to be here today in person rather than trying to make my way through an airport while the committee is in session. And thank you, Minister, for being here today also. I'd like to talk a little bit about the healthcare is really important, and obviously sick time is important. But we really haven't talked about the cost to businesses to have this program in place. I'd like to make one comment about what I've heard here today, and that is that I don't think any of the benefits should be retroactive. From a business point of view, if they're going to start, they should start going forward only. And I don't think we should pay out benefits until they've been earned. Because if we start paying out benefits before they've actually accumulated, it's going to be very costly from a bookkeeping point of view. And if an employee leaves before they've earned the time, it just creates all kinds of problems. So I think you have to earn it before you use it, and we can't use it retroactively. But in terms of what businesses are facing today, I mean, they're facing enormous challenges. We're talking about inflation now. That seems to be the big thing in the House of Commons. We know that's going to have an effect this year with wages on employees are going to have to go up. Raw materials are going up in cost. There's taxes that are going up, carbon taxes, the environmental costs are going up, regulations. Bank loans are going to be more expensive with interest rates. And now we're asking businesses, and we've said up to 58% of companies or employees don't have these benefits. These benefits are going to have to be a new cost. And how have you thought about what the total costs are going to be and how businesses are being able to afford this and continue to provide their services?
Mr. Benson, good to see you. Visually, we followed some of your journey yesterday. It was a bit shaky, but it's good to see you in person. Let me assure you, first of all, just on a personal note, throughout the pandemic, through most of it, because conditions were better here in Newfoundland than in most of the country, my husband was running a restaurant. I heard about the costs and sometimes onerous costs on business and how government programs were affecting his business every day. And so, I mean, I'll say that just in a colloquial way, but also I can tell you that from our department's point of view, we pride ourselves in spending time not only with stakeholders, with unions and organized labor, but also speaking to employers equally as well. So taking both of those perspectives into consideration is incredibly important. As I said before, and I will say it again, the last 2 years have shown us what the cost of not acting now could be. Productivity loss, quarantine, shutdowns, lockdowns. So the economic cost of inaction is far greater. But I mean, that said, we recognize that there could be a significant cost to employers based on how this is implemented. So, we also recognize that employers have unique needs, that we need to engage with stakeholders, with employers directly, with workers, as we move towards implementation. So we committed to convening the provinces and territories to develop that national plan, because it's not just about federal workers, it's about strengthening the social safety net for workers across Canada, and not just employers within the federal jurisdiction, but obviously, within provincial and territorial jurisdictions as well. We got to get it right. We need to get it done. And I don't mean to be sweeping in that, but we know what a lockdown has done to these businesses.
So when the businesses have all this increased cost, the first thing they have to do is they have to raise their costs to their consumers, and that means that take some of these businesses you're talking about. We're going to be competing against international companies that may not have to have this added cost. So WestJet might be competing against, American Airlines, and WestJet may now have to have this extra cost where American Airlines doesn't. WestJet's tickets might get more expensive than American Airlines. People won't want to fly WestJet. Doesn't this also hurt the economy in terms of potentially making us uncompetitive in some areas?
The economic numbers, I would say, from a macroeconomic point of view, speak for themselves. We have recovered in a more fulsome fashion, I would argue, than the Americans have, and we've been able to get more jobs back and get more people employed because we took significant measures that we had to. When you're, that is not to say, I'm not just going to sit here and say, well, if you don't do it, the cost is even greater because you shut down. In getting through it, there are still significant costs to employers. And we got to take that into consideration. So look, what I'm telling you is, were I appearing before this committee in normal COVID circumstances, I would say, look, we're trying to get public health, public safety balanced with workers, but also with employers, and making sure that we don't put onerous costs on them, on small businesses, particularly. I'm thinking that absolutely, trying to get that balance is right. But now with Omicron, I am telling you. It is serious, and it is immediate. And while I am not taking my eye off implementation or the nuances of it, and making sure that we do not add onerous costs to small businesses, I am telling you this is a very, very significant variant at a very difficult time of year. I would acknowledge, coming into the Christmas holidays, where gatherings happen. Where people are busy and people are out and people want to celebrate. And the last thing they want to hear is about an impending variant and the government's response to it. But it's happening. It's happening.
Thank you, Minister, and thank you, Mr. Benson. We'll now move for the final question in this round to Mr. Coutu.
Thank you very much, Mr. Chair, and thank you, Minister, for being here today. This issue is an important issue to me, personally, because of the community I represent. Don Valley East, there's it's a great community, but there are pockets where there's a low income, as low as $50,000 family income per year. During the pandemic, there were a lot of families that came in to see me, to talk to me virtually or by phone, to talk about the impact of unpaid sick days on their lives. And I know that 42% of Canadians actually only have paid sick days. I think the numbers are about 42%. And as one's income becomes lower, it actually goes down to, I think the lowest income is about 10% paid sick days. So, an additional 500,000 people getting paid sick days would be really impactful for many people in this country. So I think it's a great thing. In fact, last year I introduced a private members bill at the Ontario legislature asking for 10 paid sick days because it was something that a lot of people came to speak to me about. When you hear those stories out there, it really comes down to just basic decency. It's about dignity. It's about making sure that a person has their back covered by the company they're working for. that the government's putting in legislation that's actually aligned with where people are and the lives they're experiencing. And I was hoping that you could just take a few minutes to talk about some of those conversations you had with everyday Canadians and about how this pandemic's impact them, specifically around paid sick days.
I'll use that quote again only because it had such an impact on me. Stop calling us heroes, start treating us like human beings. That gets to your point about dignity and dignity of workers, and I'm sure that is something that this committee deals with regularly. Of course, talking about the dignity of workers and the dignity that should be afforded to them. I am here to just today, on this day, to once again implore you of the urgency of this. To your point, it is the individual decisions that people make every day and the multiplier effect of that through this country that will have a significant impact on how we deal with Omicron and how we deal with COVID. To make sure that we do not go through the significant lockdown this country has gone through before. That those individual decisions that people make when they feel they might have a symptom of COVID, and unfortunately too many in a position where if they did not show up at work, they possibly could not make the rent or could not pay their mortgage. They had to make a choice between a sick day and groceries, where we can relieve that pressure so people can make honest decisions based on the symptoms that they have, that they should stay home. Think back to the early days of the pandemic, as we saw workplaces pinpointed, as we saw COVID spread through particular workplaces, and where we could have minimized that. And I'd be the first one to say yes, but here we are now, knowing better, having learned our lessons. And on any other day, as I said, even a few days ago, I would have come here with urgency, but today I come here with great urgency, and I implore this committee. I thank you, first of all. I know that you will be working very hard in the next 48 hours, and I thank you for that. It is not work that is going to waste. This is more than just politics, ladies and gentlemen. This, getting things like this done right now will have a deep effect, even in the next few weeks and months. I would make the argument on just how bad Omicron could be. We need to minimize it where we can. We absolutely do. It is here. But our ability to deal with it, we have shown the world, to be honest, how well we can deal with this collectively. Again, the individual decisions that we make, that collectively what a difference it made. And it ultimately, what counts here are lives saved. The number of lives saved in this country. This will save lives in the very short term. So I thank you for your kind attention and for your concentration on this. In the next few hours, it will be recognized and noted, and I am deeply appreciative.
That concludes, Mr. Minister, that concludes the first round with your attendance. Thank you for the time before the committee. We will suspend for a moment while we welcome two additional witnesses from two departments. So again, thank you, Minister, for your time. And
thank you all, and Merry Christmas.
We have to do a brief sound check, and I just want to advise, I'll be going back to the first speaking order, but it's each party will decide who they want, so there will be 5 minutes to Madame Chabot and 6 minutes to Madame Chabot and 6 minutes to you, Mr. Bulleris. So, and the Conservative and oppositional Liberal government can decide who they want to choose their 6. A brief suspension while we do a sound check with the two joining witnesses. Members, we'll just give a moment until Madame Chabot and Monsieur Bullers come back. Where did we? I'm resuming the meeting, and at this time, we have about 25 minutes, and I want to welcome to the committee Mr. Wolf. Is he on the screen yet? No?
I'm here, yes. Thank you very much.
Oh, sorry. Okay, Mr. Wolf and Madame Kleinberg.
Hello, good afternoon.
Welcome. So we'll resume the second part of the meeting with witnesses, and for the first round of questioning, I will go to Mr. Ruff for 6 minutes.
Thank you, Mr. Chair, and thank the officials for showing up for today's committee meeting. Unfortunately, the minister's gone. He did talk quite a bit about the importance of getting this bill through. And I guess my first question, because I know I've heard the minister try to answer it in the House before unsuccessfully, is would it not be a lot faster, considering the urgency, especially of the sick leave portion of this bill, to split this bill into two separate spots? Would that not definitely get it through the House and through this whole review process a lot faster?
Direct your question to.
Well, whatever official wants to answer it, go ahead.
You've heard the question.
Perhaps it's Andrew Brown with the Labour Program at ESDC, and I'll jump in on that. Thanks for the question, member. And what I would just say there is that these are priorities which have been identified as the government, both in terms of providing support to workers, as well as protecting healthcare workers as well and patients who are trying to access the healthcare system. So these are both priorities which have been advanced for consideration by Parliament.
Yeah, thank you. I guess my question was, would it not go faster if we split this? But I guess my next question is to Madam Kleinberg. On the justice side of the House, does this bill, to me, it doesn't do a whole lot of anything new. It's already illegal, intimidation, trespassing, assault, obstructing people from getting to their workplace. So could you just elaborate a little bit on what specifically is new that we don't have already within our criminal laws?
Thank you for the question. One thing that is specifically new in the bill is for the offense of intimidating a healthcare provider or a person seeking access to a health service. By making this a new offense, the penalty has been elevated. There is an offense of intimidation in the criminal code already. That would cover this behavior. It currently has a maximum penalty of 5 years. So creating a new offense is coupled with an increase in the maximum penalty for this offense. This recognizes the harms to those threatened, to the healthcare system, and to those who may be unable to obtain services as a result of acts of intimidation directed at health professionals. And other than that, the creation of this new offense, as well as a new offense for obstructing access, in addition to the other measures in the bill, is the creation of 2 aggravating factors on sentencing, which go beyond what is presently recognized by the courts under the common law for recognizing the gravity of offenses when punishing offenders. So those are several new measures that are in the legislation.
Thanks, Madam Kleinberg. I guess just to expand on that, that somewhat makes logical sense, the importance of, stopping people that are trying to stop people to get to their work, especially vital healthcare workers. But would this not then make sense to actually expand this to include other critical infrastructure that's so vital to our economy, to other, key workers, essential workers across this country, and expand there? And how difficult would it be just to make that simple adjustment to the bill then to expand it to include more than just healthcare workers, but actually all critical infrastructure in the country?
Thank you for the question. I think that is actually a somewhat complicated question for the following reason. So there is an offense already called mischief to property, which involves a lot of different kinds of misbehavior towards property, public and private property, and also critical infrastructure. And the new offense that's been proposed for obstructing access to health facilities really targets one kind of misbehavior towards property, and that is obstructing or impeding access into the property. It doesn't cover other types of criminal conduct, such as damaging property, destroying property, rendering the property inoperative. It could be that in the case of critical infrastructure, those are the kinds of behaviors that are more at issue, the kinds of wrongdoing that we're more likely to see, and they actually are not included in the specific offense in this legislation. So I think it's somewhat of a more complicated and perhaps a different kind of issue in terms of the behavior that people engage in when they're targeting critical infrastructure as opposed to health facilities.
Yeah, thanks. I can acknowledge that portion of your answer. I guess I would just counter back that if that's all we're talking about, the obstruction part, it would make sense that that could apply just as easily to all those other critical infrastructure, critical sectors, if it's just the obstruction bit with employees. I guess the minister tried to answer this talking about the protection of free speech, peaceful demonstration, or unions, etc. Just want to make it crystal clear or get that clarity that this bill will not stop those Canadians that want to address their disagreement with where the government's going or where certain sectors are going, whether or not it's healthcare or where it is, that this is not going to interfere in their ability to have free speech in this country.
Thank you for the question again. And in this regard, I will draw the committee's attention to the specific subsection of the bill that would create the defense that the minister and Ms. Wright have referred to earlier. In the legislation, as it amends the criminal code, there would be proposed a new section 423.2. And subsection 4 of that new offense includes the defense that says no person is guilty by reason only that they attend at or near or approach a place referred to in the offense for the purpose only of obtaining and communicating information. And I'm happy to inform the court that defense like this was first introduced into our criminal code in 1934. It presently exists in relation to several offenses in the criminal code, and specifically offenses that are like the one being created. And this defense has been interpreted by the courts and applied by the courts, including in contexts involving protest and picketing. So from a criminal law point of view, the criminal courts are very familiar with this kind of defense. The exact same language has been used precisely so as to inform the criminal courts that Parliament's intent is that they apply the same reasoning and the same principles in terms of this new offense. So it is very clear from a criminal law point of view that peaceful protest, peaceful picketing cannot result in a criminal conviction because of this inclusion.
Thank you, Ms. Klein. Now for 6 minutes to Mr. Collins.
Thanks, Mr. Chairman, and good morning. And through you, my residents in Hamilton East Stony Creek have questioned the requirement for the medical certificate, or doctor's notice, some people may call it, and they, like the minister referenced, might see it as a barrier or an obstacle in terms of taking advantage of the benefit. And I know that time is of the essence, of course, as the minister referenced in his comments. And I think there was also the comment that some of the stakeholders may have presented, and that was that there might be the opportunity with the requirement for the medical certificate that there may be unintended consequence of overwhelming the healthcare or medical community. And so my residents have raised it with me that it's something that they'd like to see modified or amended as part of the legislation. And I'm curious to know through you how we landed on the strict requirement for a medical certificate as part of the legislation.
Great, and thanks for that question, Mr. Collins. So, in terms of how we landed upon that requirement for the medical certificate, I'd first like to note that it's not a general requirement. It is actually a tool that would allow employers to validate the medical leave requirement if necessary. So there isn't a requirement that an employee provide that medical note unless requested by their employer. So it wasn't intended to be a barrier to prevent employees from accessing leave, but we've certainly heard that from stakeholders, hearing that from you as you relayed on from your constituents, and as we heard from the minister earlier, openness to taking a look at language that would adjust the certificate requirement. So I think that I would really try to would leave it there. This is sort of a new element in terms of a paid leave. There are limited paid leaves currently available under the code, and so again, this was something that would be a tool for employers if they felt they needed to request some kind of validation from the employee.
Thank you for the answer. And through you, Mr. Chairman, my next question would be around the whole area of consultation with stakeholders in terms of unions, employers, and employees who would be affected or impacted by the legislation. So can I get an understanding, knowing that we landed on the 10 days and the requirement for a medical certificate, what led us to that decision with the comments that we heard from stakeholders? Because we're starting to hear from some of those very same stakeholders that the legislation as written needs to be amended in a couple of areas, and I'm glad to hear some of the comments from some of the other party members around the same. So can I understand, were those issues raised as part of the consultation and recommendations were made to the contrary, or how did that work out prior to it coming to the House in its current form?
Okay, great, and thanks for those questions.
Okay.
So I understand that to be, trying to understand better what stakeholders have had to say with respect to the requirement for a medical certificate. And I think really in that regard, we have heard from a variety of stakeholders, as you point out, particularly from some in the health profession. They have been questioning the need or the added value of providing a certificate. We have also heard from other stakeholders that have been concerned about not having the ability to be able to check on the validity of an employee using the paid sick leave for its intended purpose. So again, the whole purpose of having a certificate requirement was that if needed and within 15 days after the employee returns to the workplace, that the employer would be able to request a medical certificate if needed. That would be a validation, but the employer is not required to ask that from the employee.
Thank you for that answer. And through you, Mr. Chairman, I would ask around the whole issue of the sense of urgency. We heard from the minister, and we've seen rising case counts across the country that causes us some concern in terms of using all the tools available to all levels of government to combat the spread of the virus. And so I get a sense from some of the comments we heard in the speeches in the House and some of the comments we've heard here at the committee that there's a desire to move this forward and further protect Canadians. My question is, if passed, and I certainly don't want to jinx the process, but if and when it's passed, how is it? How quickly does it make its way to the workers who will then receive the benefit? And so my postal carrier who's delivering the mail, who may contract some symptoms or may feel that it's safer to stay home because of some of the health issues they're experiencing. How quickly would the benefit flow through to the employees in federally regulated industries Is that first quarter of 2022? Is that something later next year? Can we get some idea in terms of how quickly the benefit will flow through to the employees?
Great. Thanks for that question as well. So absolutely heard of the urgency from the minister this morning in reference particularly to the Omicron variant that is showing up across the country. In terms of how it would be brought into force and the benefits would flow through to workers in the federally regulated sector, the bill would come into force by an order in council in terms of identifying the coming into force date. And so that has not yet been determined. As soon as it is brought into force, it would start to apply immediately to workers across the federally regulated sector. And so as we've heard and as the bill is currently drafted, they would start to earn 1 day of paid sick leave per month worked from the time that it comes into force.
Thank you, Mr. Brown. Now, Madame Chabot for 6 minutes or less.
Yes. Thank you, Mr. Chair. I have a few questions regarding the Canada Labour Code. We want to give 10 paid sick days. When you look at the bill as written, well, we have several questions. We want to make sure that this right will be well regulated. Regarding the medical certificate, well, in Quebec, we have labor standards regarding holidays. There is this requirement to give a certificate. However, if the circumstances justify it, you have to give the certificate. So it's important to say that. You can break your arm, you can have a stomach flu. So I believe that it's important to be flexible. That's what I'm trying to say. I have questions regarding Article 1. Or rather, Section 1.2 of the Canada Labour Code. So it says that an employee earns at the beginning of each month after completing 1 month of continuous employment. So what do you mean by continuous employment? That's my question. If you already have a leave, does it mean that you have stopped working? Answer. Thank you very much for your question, Ms. Chabot. Perhaps I could ask Douglas Wolf to give you an answer regarding this question about continuous employment. Good morning. Thank you very much for your question. Yes, it's a very important question. So regarding this section, it starts when an employee starts to work. It doesn't have to do with the fact if you take sick days or holidays. It will not stop this continuous employment. So it's when you start your employment that this period will start. I have another question. Now, Section 1.4 of the bill. It says that a person can accumulate days. So if you have accumulated 10 days and you are not sick, well, these days will be carried forward to the next year and an employee will be able to use these sick days. Or do you have to go back to 0 to accumulate 10 days? I understand that you cannot have more than 10 sick days. That's a choice. I understand that. However, if you haven't taken these 10 days, how to make sure that the person will not be penalized the year after? Answer. as written in the bill, inaudible. If an employee has accumulated 8 days, 8 paid sick days, inaudible, on January 1st, if the employee hasn't used the days, the connection has cut, inaudible, inaudible to the interpreter. It is possible to accumulate 2 more days in order to have 10 paid sick days. That's how it works. Inaudible. The sound is cutting. The interpreter cannot interpret.
Prochaine année.
La traduction, Monsieur le Président.
The problem with
Mr. Chair,
can you repeat? Répétez, s'il vous plaît.
could you repeat, please, Mr. Brown? Yes, of course. Regarding paid sick days that haven't been used during the year, a given year, the employee will start the next year with these days, with these paid sick days. So the employee will not have to start from zero. Obviously, if the employee used her or his 10 days, then it's different. Ms. Chabot, do I still have time? Mr. Chair, do I still have time for a question? So you say that there could be an X number of paid sick days for a person that starts a new job. So say that you have been working for 2 months, you have accumulated 2 paid sick days. And then you are sick and you need 3 or 4 sick days. But as written, the person will only have 2 paid sick days and 2 days without pay. However, I'm wondering if there could be more days given to the employee. Are you open to an amendment to that effect? Answer. Thank you for your question. The minister, inaudible to the interpreter. He is open to amendments to this part of the bill.
Now we'll go for the final 6 to Mr. Boulouris. Monsieur?
Thank you very much, Mr. Chair. Very quickly. Well, I want to make sure to have the right answer. Ms. Chabot spoke about it earlier. So the part of the bill that will change the criminal code, we want to make sure that the right to strike, the right to picketing, we want to make sure that those rights given to health workers will be protected. We've been given answers saying that yes, but I would like to have more clarification. Which law are we talking about? Which provision? Which section? We understand that it's important to protect healthcare workers. We have seen bad behavior in the past, unfortunate events in the past 18 months. But we want to make sure that these health workers will be able to exert pressure, for example, when they negotiate their collective agreement. So could somebody tell me, don't worry, Mr. Boris, this section and this law, I want to have a clear answer. I want to reassure unions, for example, who might be concerned. Answer. Thank you for your question. I will give you an answer, and then Joanne could add some comments regarding the provisions of the criminal code. So let's start with the Canadian Charter. We know that the law must respect the Canadian Charter. And the minister in the House of Commons gave some explanations. He said that this bill respects the Canadian Charter. So it's important to say that. Protections guaranteed in the Charter regarding freedom of expression and the right of expression doesn't protect violent forms of communication or forms of communication that promote violence. Inaudible. Therefore, there is a section regarding what kinds of activities are allowed. And now I will give the floor to Joanne so she can tell you a bit more about the provision of the bill. Thank you. So that the committee can see where the defense mechanism is found in the bill. So it's Section 2, but it starts at Section 1 of the bill. So that's where you find an amendment to the Criminal Code, and then you have Section 2. It's on page 1 of the PDF file of the bill, and it creates Section 423.2 to the Criminal Code. And then you have Sub-Amendment 4, and this is where we talk about defense. And it's on page 2 of the bill, again in the PDF version. So I think it's about line 8. So that's the clearest way to show you. Well, I only have 1 minute left. So I have a more technical question. It's how you will calculate, how you will accumulate paid sick days. So if a person was employed on March 6th, does the person has to wait to May to have 1 paid sick day, or are we talking about 4 consecutive weeks?
As drafted, that employee would have to wait until May 1st, as per your example. Thank you.
To the witnesses, thank you, Mr. Boulouris. That concludes the witness section of this committee hearing, but I need direction from the committee. It is my understanding that there is agreement for the committee to meet again this afternoon from 3:30 to 5:30 to begin clause by clause reading of the bill. Having agreed on that, that is my understanding, committee. I see nods in acceptance. Then we'll need to set a time for today for the submission of written proposed amendments to the bill. So what is the time you would choose, recognizing that's at 3:30, and they should be provided to the committee in both official languages? Direction? It's suggested 2:30. Do we have agreement? 2 o'clock? 2:30? Okay, we hear 2:30 for any proposed amendments to the bill in both official languages. Do we have concurrence of the committee? I see agreement.
Just to be clear, we're talking 2:30? 2:30.
Yeah, Mr. Boulouris.
Parfait, merci.
Oui. Okay. I'm told by the clerk 2 would work better than 3 in preparing for 3:30, but it's the committee's prerogative.
The amendments or the meeting?
No, for the amendments. The meeting's at 3:30.
Yes, 3 is great.
The meeting's at Yeah, the amendment package submitted by 2 o'clock.
Well, we prefer 2:30, which was originally suggested. Please.
That's fine. We take, the committee chooses its timeline, so 2:30 will be the timeline for amendment packages to be submitted. The committee will be meeting again at 3:30 to 5:30 to begin clause by clause reading of the bill.
And Chair, just for clarity, I mean, obviously we're working with different offices on amendments. That being said, if there is a table drop, we would be okay with that as long as it's submitted in both official languages.
The committee chooses its own direction and can deal with any issues that present. So, Mr. Long, thank you for your intervention. Thank you, committee members, for today's meeting. Thank you so much. Merci beaucoup.
Thank you so much.
Adjourned.